I had this knee problem for a long time now. It started when I was 5 years old. So it is painful. I have pain most of the time. And yeah, that's my life.
My wife and I were called to serve an LDS mission in Madagascar, and we were called to be the office couple. One of the things that happened is I got heavily involved with Nambine doing auditing, and he's one of those people that is incredibly hardworking, incredibly honest, someone who's trying to do the best he can.
The time I shared with him my problem, he just helped and was looking for plan and ways to get the surgery done.
So I arranged for this doctor to see Nambine. He did MRIs of his knee, and we found out that knee is just about disintegrated. It's in pretty bad shape.
So Nambine had an injury as a young man. When he was about 5 years old, he had some kind of a trauma, and he doesn't remember the specifics. And medical care there obviously isn't what it is now. And so he had an undiagnosed cartilage and growth plate injury that has subsequently gone on to basically have little pieces of broken off bone and cartilage in his joint. So the result is that he's got end-stage arthritis, typical of what you'd expect in someone who's in their late 70s and someone who's a young man as he is.
He has a wife, 2 boys, a 6-year-old and a 3-year-old. And Dad liked to play with their kids. And some of those things he can't do because of his knee. The thoughts of Nambine living his life over there with his knee getting worse and worse, I just don't have words to express how that makes me feel. Because he would go as long as he could on it, and then the option over there is to amputate it.
It was very difficult to leave home. The first thing is I was hesitating to do the surgery because I was scared, and I kept asking my wife if I should do or not, and she just gave one response. If you love us, you go and do the surgery. And that's kind of hit me hard. Even though I'm still scared sometimes, I know I have a reason why I'm doing this, and that's for my family. So, yeah.
We were approached to see if there was any way we would consider doing this service for Nambine. And my first thought is that we are so blessed in this area, in this country, first of all. And I personally believe that one of the best ways that you can show your gratitude when you're blessed is to give back. And so when I learned about this opportunity and the missionary work that the Clowers had done and the work that they had done to try and get Nambine over here, I thought we can definitely do our part.
The physical therapy, it is going well. It's very difficult and painful, but I believe it's worth it. What motivates me is it's my family, you know. I'm doing all of these things for them, and I want to be in a good shape again, to be able to do all my duties and my responsibility as a father. This is a life-changing experience to me. So I will always remember the hospital people, the Clowers, especially Dr. Barker. Without all of them, all of you guys participating, I won't be here today, and I'm really grateful for that. So thank you all of you for everything you have done for me.